One of the reasons that I'm often hired by institutions as a consultant or as an educator is because I bring this unique perspective of having that medical background, understanding the medical perspective. And at the same time, I have the perspective of having worked with the community, helped many families, understanding what it's like to navigate the healthcare system from the patient side and understanding some of the conversations that are going on the patient side of things. And so I want to bridge that gap today because what is going on that I am hearing a lot of in the transgender and non binary community is some sadness and fear with the executive orders, with the scrubbing within federal websites of the word transgender from a lot of pages, travel guides, health information, etc. And so there are things as providers, as physicians, that we can do to increase the visibility of all genders and all sexes. And that's what I'm going to talk about today. I am going to share with you four things that you can start doing. And I would offer that we should have already been doing for a long time because these four things are both medically accurate. They demonstrate our understanding of the science and the facts of sex and gender, and they allow for all patients to be visible. They are super simple to incorporate in everyday language. Once again, like last week, it does not require board approval to do any of this. So, the first one is to distinguish between sex and gender. It is something that in medicine, I don't think we do very well. I don't think as a society we do very well, but can begin to model it as physicians and healthcare providers. Now, let's remember that sex is a biological classification. So the terms to define sex are male, female, and intersex as the umbrella terms. Whereas gender is an inner sense of self. The terms for that are man or boy, woman or girl, or non binary people. Those are gendered terms. And so when we are talking about something or someone, depending on what we are referring to, we need to be really clear what we are referring to. So if we are looking at the anatomy of, say, a prenatal ultrasound, then we should identify it as the sex and not the gender. You can say what you see. What is the anatomy that you believe you see? Just like we say what we think the anatomy is of every other part of the ultrasound. If you want to interpret that as explain what classification of sex that is, and you can say it appears to be a male, it appears to be a female, it appears to be intersex, you would give that indication if you thought it looked like ambiguous genitalia on the ultrasound. Now, that's what you would say. You would not say it's a boy. You would not say it's a girl. You would not say it's non binary. Those are all gender terms. So, this is what I mean about distinguishing the two. If you are talking about obstetrics and gynecology, which is talking about physiology, anatomy, those are all classifications of sex. If you're talking about the care of a patient based on their gender identity, then you may be able to say something like men's health or women's health. But if you're saying something like women's health, then it has to be all aspect of women's health for all people that identify as women. So being very clear about what you're talking about. Are you talking about the sex of what you're looking about treating, etc., or are you talking about the gender? And let's begin to use that language very clearly. When we use them interchangeably, number one, that's not medically accurate. We know for a fact those are two distinct things. The second thing is we don't demonstrate an understanding. And the third thing is we create a lack of visibility. When we use them interchangeably, we are saying that there is no such thing as transgender people because we're saying that sex and gender are the same thing. And that's just not true. They are two separate things. So, one way to create more visibility is to use our language accurately by distinguishing sex and gender and using the appropriate terms at the appropriate times, depending on what you are talking about. The second thing is when we talk about sex, include all sexes. So, if you are talking in general and talking about all the options, many times people say, well, male or female. That is not including all the options. We should say male, female, or intersex. When babies are born, they may be assigned male, female, or intersex. Sex classification can be male, female, or intersex. Just include it. Anytime you are including what the classifications of sex are, intersex should be included in that. It shouldn't just be male or female because that's not accurate. There is also intersex. So we should include all three terms. The third thing we can do is include all genders. When we are talking about genders, instead of saying men and women, if you're going to use language like that, now you can just use one all encompassing word like people or patients, then discussion's over. But if you are going to use gender terms that is all inclusive of everybody, then if you're going to say men and women, then include all genders, men, women, and non binary people, boys and girls, and non binary children. That is including everyone. It is accurate because there are more than two genders. That yes, we are using umbrella terms. We're not going to mention every single possible gender identity term. We're going to use the umbrella terms, but we are identifying that there are identities beyond the binary. And that is how we do that. Same thing with pronouns. We don't have to mention every single possible pronoun, but we are going to mention pronouns beyond the binary. So if you are going to say he or she, I encourage you to include they. He or she or they. So if you are talking about, usually we use that when we're talking about something in general. When a patient first approaches the desk, he or she or they will be greeted by this person. So include it. Anytime you find yourself saying he or she, include or they, therefore recognizing all genders, which is accurate, demonstrates an understanding that you know that there are all genders, and allows for the visibility. The fourth thing that you can do is not hold back. And what do I mean by that? Now, this isn't going to come up very often, but there are times that decisions are made because of the institution or the department or as an individual wanting to recognize all genders. What do I mean? Maybe on your forms, you ask, what were you assigned at birth? How do you identify? And so a patient may come to you and say, what are these questions? What do you even mean? What was I assigned at birth and how do I identify? What does this mean? Sometimes people are afraid to answer those questions. They don't want to say. Answer them the way we answer all questions. Matter of fact, we are asking you, what were you assigned at birth? So what was put on your birth certificate or when you were born? Did they assign you male or did they assign you female or did they assign you intersex? Notice again, we're including all sexes there. What were you assigned? And then how do you identify? Do you identify yourself as a man, a woman, a non-binary person, or anything else? How you identify, put it there. Well, I don't understand. We want to make sure we respect everyone and understand. Just simple matter of fact. We understand that some people are transgender. We understand that some people do not identify as what they were assigned at birth. That's all. Just answer it. Don't shy away from it. Create visibility by answering honestly. I'll give you another example. Why was the family bathroom now called the all gender bathroom? Why did they change the name? Now, you may not have been a part of that decision making, but if you do happen to be, or you happen to know the rationale of what it is, Just answer honestly. You can say, I wasn't part of the decision making. However, I do believe that is there because it's not just for families, but we also recognize that not everyone identifies as a man or woman. And we want to make sure that all of our patients have a facility for which they feel they can go into and use a bathroom because that's an important part of health. And we are a healthcare facility. So just answering the question, do what we do, be matter of fact and honest. If patients or anyone else answers with their feelings, that's okay. We're used to people responding to us with their feelings. We can hear them and answer the way you would with anyone else's feelings. You're not going to argue with their feelings. You stay to the facts. We all have our own style for that one. Me, I'm very matter of fact. I hear you. I hear you're upset. Okay. Okay. You don't think the name should be changed. Okay. So that's it. It's matter of fact. But we shouldn't hide the reason, because the reason that name was changed, the reason that the documents are written that way, the forms are written that way, are a fact. The decision was made for this fact. Just stick to the facts. Don't be afraid of them. Yes, these issues have been politicized, but they are not political. They are facts that people are assigned something at birth. They are facts that people identify in certain ways. Some people identify the same way they are assigned at birth. Some people don't. That's a fact. But what we can do to be medically accurate, in fact, I would argue that we should have been doing this from the beginning. We had awareness, but I think in medicine, we're so afraid. I think sometimes we're so afraid of patients' reactions. Sometimes we're patronizing and think that people won't understand. As we understand, things change. But we have done a great disservice. When we recognize that gender and sex are different, we have done a great disservice not to start to demonstrate that in our own practice. Not to distinguish. When we deliver a baby, and we are looking at external anatomy, we are looking at a part of the classification of sex. And that's all we can say. And that's all we should be saying. When we assign it a gender, we can't really do that because we can't see gender. And we know that. So why do we keep doing that? That it's not medically accurate and we know it. So why do we keep doing it? We need to start doing what we do in every other area of medicine, practicing to the best of the ability with the facts and science that we know. Be medically accurate. Use science terms for science things. Use gender terms for gender things. And use all-inclusive terms. Include everyone. When we're talking about sex, male, female, and intersex. When we talk about gender, man, woman, and non-binary patients. It's just a fact. It is not any big deal. It rolls off the tongue once you've practiced, and it allows you to be accurate. It allows you to demonstrate the understanding that you have, and it creates visibility. So for all of those providers that say, what can I do? I'm not really a stand up and protest and stay out loud. This is what you can do. You can do your job of being accurate. You can support by creating the visibility that be there. You can support by creating the visibility. I would offer does not need to be hidden. Why? Because it's a biological fact. It's biological diversity. There's nothing that needs to be hidden. People are male, female, or intersex. People identify as a man, a woman, or non-binary in general terms. We can start being medically accurate. We can start demonstrating that we understand and share that understanding with our patients, the way we share all of our other understanding with our patients, and allow for all patients to be visible, because visibility matters.